Can breast implants make you sick? Find out on this next episode of Digest This.
Welcome to Digest This, the show that helps you revolutionize your digestive health. Here are your hosts, Dr. Liz Cruz and Tina Nunziato.
Hello, and welcome to Digest This. I'm Dr. Liz Cruz, and I've got Tina Nunziato sitting right here by my side. We welcome you. If you're a regular listener, if you're a brand new listener, thank you so much for taking the time to listen to us. We know everyone has such hectic, busy schedules, so the fact that you are taking the time to listen to us or even watch us on YouTube means so much to us. So thank you so much. So, breast implants, huh?
Yeah.
All right.
Yeah, we'll tell them why this topic came up.
Yeah, so this topic came up. Recently, I had a friend who was texting me in regards to his wife, and was just asking me, was just telling me that his wife hadn't been feeling well, and just tired, very fatigued, just not feeling energetic, not wanting to do anything, having some aches in the joints, and just not sure what was going on. Apparently saw a doctor and had a bunch of blood work that showed some question of autoimmune, like questionable lupus type of blood work results. Mm-hmm. And so anyways, he asked me to look at the blood work, and I looked at it, and I was like, yeah, I mean, she needs to see a rheumatologist. She got scheduled with a rheumatologist, and fast forward in time, I spoke with him recently, and he told me, he said, oh, by the way, just want to give you an update that my wife did go and see the rheumatologist, and basically the doctor, evaluated, took a look at everything, examined her, and essentially told her that she needed to get her breast implants taken out.
How long had she had them in at that point? Do you know?
I think for years, but I don't know exactly, if it'd been 10 years or how long. And so she went, got the breast implants taken out, which the breast implants were silicone implants. And he said that literally, it was amazing, incredible miracle, because she pretty quickly, immediately started feeling better. Mm-hmm. Had color in her cheeks, and just had her energy back. Mm-hmm. So,
and they weren't leaking.
No, there was no leakage.
No leakage.
No leakage. No leakage. Mm-hmm. So I don't know. I just found it very interesting. I did have one experience when I was a resident. So I was doing my internal medicine residency. I was doing a rotation at Stanford University at the medical center, and I was on the kidney rotation. And one of my very first patients was a young woman, relatively young. I mean, she was probably in her 40s, maybe mid 40s, and she was on dialysis. This is at the beginning of my rotation, and I will never forget. She said, "Don't ever get breast implants."
So that's what caused her to have the kidney.
She said, "My husband begged me not to get breast implants. He said I was perfect, I didn't need to do that, but I didn't listen. I went and got breast implants. My body completely rejected the implants to the point that I'm in kidney failure on dialysis."
Wow. Dang.
Yeah.
They don't put that in the side effects.
Yeah, exactly. So I just, I always remember that story. I mean, I was very impressionable because I was doing my internal medicine residency and just, pretty fresh out of medical school, and it just really impacted me. Here, this young woman, and she said, "Don't ever get breast implants." So, obviously, we are not a breast implant practice,
practice
or family. Okay, yeah, that too. Obviously, we are not a breast implant.
We deal with the other end.
Exactly.
Yes, and we definitely do not have breast implants here.
Yes.
I'm pretty flat.
Thank you, Tina, for that.
Thank you for that visual.
Yes, thank you for that visual. If you're watching us on YouTube, excellent. We just wanted to prove that. Yeah. But when we did look up a little bit on breast implants, risk of breast implants, and it's one of the most common, the most popular surgeries, cosmetic surgeries that is done. Yeah. It's very common, and we are not here to bash it. Okay, that is not what we're doing here. We're not here to bash it. We simply
know many friends
presenting,
breast implants.
Presenting like this very intriguing story. Okay,
well, and mostly just to make you aware that if you are feeling sick and you're having these symptoms and your doctors can't figure out what's going on and you have breast implants, it might be the breast implants.
It could be.
Because not every doctor is going to diagnose like that doctor did. I'm actually really surprised that rheumatologist diagnosed that.
Yeah, that was very impressive. Yeah. I mean, the rheumatologist, obviously maybe he had encountered that, but it's scary. Think about this, because this person had blood work that was pointing towards a diagnosis of lupus.
Right.
Okay, so here this person might have been
put on all these
medicines, and still possibly not feeling well because the culprit was still inside of her. Okay, I mean, you got to think that when you get a breast implants, I mean, even though and again, we are not experts at breast implants in any way, but from the little we read, silicone, saline, and I don't know if there's other different types out there, but those appear to be like the most common types. I mean, you would think saline, silicone, I mean,
it's still a foreign object going in the body.
It's a foreign object in your body.
Yeah,
exactly.
And everybody's body is different, right? So everybody's body is going to react differently to that foreign object, and even if they're not leaking.
Right. Exactly.
It's still a foreign object. So
it's a foreign object. So it is something, just to keep in the back of your mind. If you do have, like Tina said, if you do have breast implants, and God forbid, hopefully this won't happen, but if at some point you do start to develop any issues where nobody is really being able to pinpoint the cause of it, it's just something to keep in mind. In fact, in some of our reading, we even read about a very rare form of cancer that can occur in relation to these breast implants.
Yeah, and I have done consults with plenty of women who, I'll say a handful over the course of the last 10 years that have told me stories similar to that, where they've had them removed because of health issues. So again, it's not everybody. Right? But there's people out there that this happens to, that they have to have them removed for one reason or another. So it's just to make everybody aware that could be the culprit behind your symptoms. And so just be aware. Joint pain, I know, is one issue.
Even gastrointestinal. I mean, which we have had patients. I can specifically think of a patient that we've had, in our couple decades of practicing gastroenterology, that specifically said that they started having gastrointestinal issues after their breast implants, after they had surgery.
Are they put on antibiotics after that surgery? I would imagine they are.
I have no idea.
I mean, with most surgeries, most people are put on antibiotics after surgeries. And again, that could also be the issue, right? Is the antibiotic.
Who knows? Yeah.
Or the foreign object you just put in your body, right?
Yeah, absolutely.
But
absolutely. I mean, so just something to keep in mind. It's I just found it fascinating, and I was so happy for this friend, that has seemed to have turned the corner, and they're going to be repeating labs sometime soon, and I hope and pray that their labs will normalize. And I mean, that, again, great catch on the part of the rheumatologist.
Yeah, absolutely.
So.
It's awesome.
Yeah. So if you would like to connect with us, you can find us on our website, drlizcruz.com. There is a magenta colored button on the homepage that you can click and schedule a free 30-minute wellness consult. And again, it's free. It's done over the phone, so you can do it from anywhere in the world, okay? If you haven't rated us, please rate us and give us a 5. That'll help other people just like you to find us quicker. And lastly, if you haven't subscribed, please subscribe so that you never miss an episode. Thank you so much for joining us, and we will catch you on the next episode.
Thank you for joining Dr. Liz Cruz and Tina Nunziato. To learn more about their revolutionary products and services, go online to www.drlizcruz.com.